Hi, it's Dr. Golio here at Avana, trying to tell you, answer some questions regarding brow lifts. I'm going to tell you about brow lifts today. So many patients will come in and they'll feel like they have a tired appearance. So what they'll notice in the mirror is they'll notice that their eyebrows are starting to droop or their eyes are getting very heavy, and they'll feel like they're tired all the time. One of the things I always encourage the patients to do is look in the mirror and try to lift your brows up with your hands in this manner. If that takes a lot of weight off your eyes and your eyes feel more comfortable, you might have what they call brow ptosis. Brow ptosis is a phenomenon more common in women than men, but happens in both. And the reason why is as we age, gravity is pulling the soft tissues down. And what occurs is the brows will now fall below the rim. So anatomically speaking, brows in men and brows in women are a little bit different. Women do not have a prominent supralateral orbital rim and a superior orbital rim. This is because of the secondary sexual characteristics that men develop after the age of 18, where they'll get the prominent, strong, masculine brow. Women don't have this. So they'll tend to notice brows falling earlier than men because they don't have the soft tissue support. That being said, men can also develop this as well because everyone's a little bit different. One important thing to remember is that brows are integral parts of your eyelids as well. So it's very important to know whether or not the eyelids are also droopy or is it just your brow. That's very important to come in or do a virtual consult with us, or with me specifically, to show and be able to determine, is it just the brow, is it just the eyelids, or is it a combination of both? The reason why that's important is the following. If you have a combination of brow ptosis and dermatochalasis, meaning extra eyelid skin, so the brow's fallen and there's extra eyelid skin, the correct way to fix this and the appropriate way to fix it is to first lift the brow and then do the eyelids. The problem is many people will get their eyelids done thinking it's just there's only the component of the eyelids involved. And that's not really the case. Actually, the brow is a part of it. So now they've had eyelid surgery, and now it becomes very difficult to lift the brow because we don't want to have them not able to close their eyelids. That's called exposure keratopathy or lagophthalmos because the eyelids are not closing. So we don't, and that's what causes exposure keratopathy. So we don't want you to develop something called lagophthalmos, which is when the eyelids can't close. That's why it's very important to go to a person who has the experience, the correct experience and training to know what the difference is and to be able to treat you appropriately. The surgery part of it takes about 45 minutes to an hour. And there are many different ways to do brow lifts. There are something called direct brow lifts where we make an incision above the eyelid. This is typically done in older men who have very heavy wrinkling. There's something called a endoscopic brow lift where small incisions are made in the skin and the brows are lifted off of the overlying bone and then repositioned. There's something called a coronal brow lift, which is the incisions can be very small along the sides or from ear to ear, depending on what you need. So based on what your physical findings are, we'll determine what's the best surgery for you. In my experience, I tend to do a modified coronal approach, and the reason why I do that is after many years of doing brow lifts that were endoscopic, I found that they keep falling over time. So that's not ideal. You don't want to do a surgery and then in 4 or 5 years need another surgery. So I made a modified technique where I actually do what they call a hemicoronal, meaning partial incision, where we lift the brow above the bone, get a full lift, and actually remove almost 3/4 of a centimeter of excess tissue in your hairline. This ensures that this will last you a lifetime. So that's why it's very important that we give you the options and you have the surgeon with the correct experience to determine what's the best fit for you. So, post-operative care, very important. How do you take care of yourself after a brow lift? Well, depending on the type of brow lift you have will determine your post-operative care. Direct brow lifts are usually just applying ointment and cold compresses for the first 24 hours and then warm compresses after. These are important to help facilitate the drainage and reduce the swelling that's present. Remember, in any post-operative situation, you want to follow the instructions of your surgeon. It's very important to follow those to the T. You want to make sure that the head of the bed is elevated 45 degrees. You don't want to do any heavy lifting or strenuous activity. You want to make sure you take care of the incisions appropriately. Okay? Remember, you've made the investment in surgery to look better and to see and feel better about yourself. Make sure you take the time to follow all the instructions and invest in your recuperation. It's an important part of it. So the recovery period is typically 7 to 10 days. Some people a little bit less, some people a little bit more. Who would be more, who would be less? Well, people with high blood pressure or diabetes might take a little bit longer period of time to heal because of those comorbidities. People who are young and healthy and who have a brow lift typically can see their results within 7 days, and the swelling is usually gone by 10, the majority of it. There is some residual swelling that may still be present, but that disappears over a few weeks. So, very important to know that follow up also on your post-operative appointments to make sure that everything's going well. Make sure you take all your medication as prescribed, and make sure you give your time, you invest in your recuperation to give yourself the best chance at recovery. I'm getting some questions from patients regarding what do I do with my chin and neck. So a lot of times patients will come in and they'll feel that they don't look 100% in their profile, or they've noticed that they're starting to get some extra skin underneath their neck. So depending on what you have going on will determine what's the best course of action to correct the issues that you find yourself having. For example, there are some people who, when you look at them straightforward, they look fine. However, when you look to the side, you might see they have a deficient chin or a protruding chin. Based on which one we see that you have, we can do a surgery to help either augment your chin, meaning bring it forward, or reduce it. Okay, this will help to improve your profile dramatically. There are several ways to do this. Typically, some surgeons will like to put implants in and anchor it to the bone. I do not like to do that, and the reason why is the following. When you put an implant into the chin to make it a little bit more prominent, what occurs is you don't stretch the muscles. The muscles of the neck are attached at the chin bone. So what we like to do is the mandible, okay, the menton portion of the mandible. So what I like to do is I actually like to cut the bone and move it forward. By doing that, we're actually advancing the muscles and tightening them as well. That's very important. So you should try to find a surgeon who's basically very comfortable doing what we call a sliding genioplasty. The other option is if you have a very prominent chin, you can reduce it. The other way to do that is cutting and setting it back as well. Same technique, however, you're not bringing the chin forward, you're bringing it back. There are also patients who have a muscular component to it, or they have a separation of the platysma muscle. What happens there? Well, these patients tend to be a little bit older, late 40s, early 50s and beyond. And these patients will start to notice, for lack of a better word, they'll call it their turkey neck. And what's happened is all the fascial attachments have kind of drooped. So in those patients, it's very important to make sure that we tighten the muscle. Some patients will need to also have a neck lift with it to ensure that all the excess tissue is removed. That's very similar to a facelift. And some patients will also require liposuction to the area. There are a subset of patients who have something called an obtuse cervical mental angle. Well, what's that? That is when the angle of the neck is not at a 90-degree plane. It's actually at a 45-degree angle. Those patients are a little bit more difficult to get to the correct position. So what we actually have to do is we have to actually transect the platysma horizontally. And by doing that, we allow you to have a nice, we reduce the angle from 45 and turn it into a 90-degree angle, along with some skin removal as well. Those patients tend to do very well and they're usually very happy, but it's important that on your preoperative evaluation, that's addressed, because patients who will then come in and say, well, I wanted my neck to look a little bit better, and if that obtuse cervical mental angle is not addressed appropriately, they won't be happy with their results. So How long does the surgery take? The surgery typically takes, for chin, osseous genioplasties typically take about 45 minutes to an hour, both augmentation or reduction. Those patients, the postoperative care is you'll have an incision inside your mouth. You have to make sure that you take all your antibiotics and your painkillers, follow the instructions. You'll have some pins. You can't do anything very, very strenuous for about 3 to 4 weeks after that because we don't want to jeopardize the bone movement, okay? The bones are fixated with pins and screws, but any kind of trauma to the area, if you don't take good care of yourself, can jeopardize the surgery. For the neck lift, same thing. You want to make sure that you take good care of yourself. The recovery period is typically 7 to 10 days. You may have to wear a compression bandage for up to a month or more, depending on how you heal. This allows you to keep that definition that your surgeon achieved for you during surgery. It also helps to reduce the swelling to the area. Once again, the recovery period is about 7 to 10 days. And also patients who have diabetes and hypertension, it might be a little bit longer, but typically healthy people, that's the correct period of time. Remember to always follow your postoperative instructions. No heavy lifting, no strenuous activity. Make the investment in your time for your recovery. You're making the investment in the surgery, so make sure you take the same amount of investment and make the same investment in your recuperation. It will really help speed things along. Your postoperative instructions are typically have to be followed precisely. You want to make sure you take all your medication, follow the instructions of your surgeon to make sure you have the best possible outcome. I'm getting a lot of questions regarding rhinoplasty. What is it? How do we do it? What's our recuperation? When can I see the final result? So I wanted to answer those questions. Rhinoplasty is probably one of the most complicated surgeries in plastic surgery, because you are now taking someone's nose and you're refining it, making sure it fits their face. So there's different types of rhinoplasties. There's something called primary rhinoplasty, where you are just doing the tip and fixing the cartilage, or in certain cases breaking the bone. There's something secondary rhinoplasty, where you have already had a rhinoplasty and you weren't happy with the result, so now we have to take, in some cases, cartilage grafts to fix the areas that are deficient. There's something called cleft rhinoplasties. People who had cleft lip, cleft palate will sometimes need a rhinoplasty at the age of 10, 11, 12 years old. That's to fix the anatomic defect they had as well. So the nose is an integral part of your face, and it's important both when people are looking at you straight ahead and also from the side on your profile. So, and also your ethnicity can make a difference in terms of the rhinoplasty techniques that we use. So we always want to make sure that, one, the nose will fit your face, and two, make sure that the expectations are realistic. So one important thing that also you need to remember is your jaw is an integral part of your profile. And in certain cases, the rhinoplasty also needs to have your jaw looked at, because yes, we can correct the dorsal hump that you might have and reduce the nose, but if you don't have a prominent enough chin, those patients will not be happy with their profile still, and they will sometimes require an osseous genioplasty to bring their face into harmony with for their profile and looking straight ahead. So let's talk about primary rhinoplasty first. What is it? It's the rhinoplasty that's done for patients typically who don't like their tips, their nasal tips. They feel they're too wide or too thick. They feel like there's a large hump on their nose, a dorsal hump, or they feel like the bridge of their nose is too wide. Those patients benefit from a primary rhinoplasty. What we'll do is, there are two types of rhinoplasties. There's a closed approach and an open approach. The approach I use is open, and the reason why is the following. It's very difficult to get the anatomical exposure you need with a closed rhinoplasty. So, I know many people don't want to have the incisions, the external incisions, but to really, really do the job correctly, in my professional opinion, you need to have an open rhinoplasty. So what will we do in an open rhinoplasty? We'll make an incision on the external part of the nose here, and then the incision will be extended through the internal parts of the nasal vestibule. What we'll then do is we lift the skin and any soft tissue and muscle off of the cartilaginous tip, which is all the cartilage, the soft part here of your nose. What we then do is we look at the cartilage and we see where it's deficient, what we need to do to it. Typically what we'll do is we'll put something called a columellar strut, which is to give support to the nasal tip. This is very important because we can now make sure that the angle of your nasolabial angle is appropriate. Women typically have a nasolabial angle of greater than 95 to 100 degrees. That gives them that nice elevated tip. Men typically have a more masculine profile with a nasolabial angle of 90 degrees or less. So the columellar strut that we put in helps us to perfect the angle that we want you to have. The other thing we'll do is we'll remove some extra cartilage if there's bulky cartilage there. What we'll then do is we'll take that cartilage and sometimes we'll use it to make additional grafts to help make sure that the nose has the correct projection and profile that you want. People who have a widened bridge, we will break the nose so that you can now have a narrower bridge. People who have a dorsal hump, will shave that down. So basically what we'll do is there's a bony portion of the hump and there's a cartilaginous part of the hump, which is cartilage, and we'll shave the cartilaginous part and the bony part down to give you the profile that you desire. So depending on what you have, a lot of patients will sometimes need as well some nasal packing in their post-operative recovery. The surgery takes anywhere from 2 to 3 hours, and for primary rhinoplasty. Secondary rhinoplasties can take 3 or more, especially if you need cartilage grafts for deficient areas where you've already had surgery. There are some people who also have septal issues. That's a whole separate thing where we can help with the breathing, but I'm not going to address that in this video because we're just talking about the primary rhinoplasties now. The recovery period. So once the surgery is done, we will then close the nose so that you don't really see anything. You'll also have, if you've broken the bone, you'll have a protective bandage, almost like a cast over the nose. And you may have you may or may not have nasal packing depending on the extent of work that's done. That will stay in usually for about 4 to 5 days. In some cases it will dissolve on its own. In some cases we'll be able to take it out. You'll have bandages on your nose. Those will stay on for up to 2 weeks. Okay. The initial swelling, the recovery period is 7 to 10 days. Once we remove the cast and remove the bandage, you will have a very good idea of what your nose looks like. The only thing is you'll have some swelling at the time. That swelling will go down anywhere between the first 7 to 10 days. The majority of the swelling goes down, with the residual swelling going down over 3 to 6 months. The final result of a rhinoplasty is between 6 months and a year, but you'll have a good idea of what your nose will look like much earlier than that. The other thing is when you feel your nose after a rhinoplasty, it will feel firm and hard actually. That's just the healing cartilage. That will soften up over time. That as all the swelling and inflammatory tissue goes down, the nose will become soft again to what you're accustomed to. Once again, recovery period, very important. As your post-operative recovery and following the instructions is as important as all the pre-op preparation and surgical procedure. You must take it easy. No heavy lifting, no strenuous activity for at least 3 to 4 weeks. Remember, your nose in certain cases was broken and you have sutures holding the cartilage together. We want to give that the time to heal. Very important. So the investment that you make in having the surgery is the same investment you should make in your recuperation to make sure you give yourself the best chance at an optimal result. So always follow the instructions carefully. Any questions, always call your surgeon. But for the most part, it's very important that you just take care of yourself and realize that you have to take some time off to relax.